Hi, my name is Jess Bradley and I work for an organisation called Action for Trans Health. Action for Trans Health is a patient advocacy service and a campaign for democratic transgender healthcare here in the UK. Today I wanted to talk a little bit about bridging prescriptions. Bridging prescriptions and bridging medications is something that a trans patient who is self-medicating with hormones, perhaps they're bought off the internet or accessed through a friend, can access. So a GP will provide bridging prescriptions to somebody as a harm reduction measure. The idea there being that hormones that are bought off the internet or via a friend, we don't know what the quality of those hormones are. We don't necessarily know if they're cut with anything. So the idea is that it reduces the harm associated with taking those hormones by simply prescribing hormones that the source is known by the GP and are kind of official. So a GP will be looking for a few things when kind of deciding whether or not to give bridging prescriptions to somebody. So first of all, the person needs to be self-medicating or at risk of self-medicating hormone treatment. So usually that means maybe they're buying estrogen off the internet or sourcing testosterone from somebody at the gym or through a friend. But a person will usually have to prove that they are self-medicating or that they're at risk of self-medicating. Secondly, a person needs to be at risk of self-harm or suicide as a result of not getting proper treatment through the NHS for gender dysphoria. So maybe they're on a waiting list and it's going to be particularly long before they get treatment, and that's having an impact on their mental health. But crucially for this point, self-medicating itself can be argued to be a form of self-harm because it involves an element of risk. So even if you aren't depressed or self-harming in the traditional sense or at risk of suicidal ideation, you can argue that self-medication, because it involves an element of risk, that you're willing to put your body at risk to access hormone treatment, that this will satisfy those or this can, in some cases, satisfy those criteria. So because of the way that the legal issues around bridging prescriptions work, when a GP agrees to give bridging prescriptions, they're actually slightly more liable if anything goes wrong than if they go through the more official channels of a shared care agreement with a gender identity clinic. And because of that increased liability to the GP itself, they're often quite reticent to give bridging prescriptions to people. They might be worried or anxious about not knowing enough information about transgender healthcare, or worried just in general that the way of accessing these hormones are not going through the kind of official channels. So for a lot of doctors, you kind of need to reassure and give a lot of information around bridging prescriptions to make them feel like what they're doing is the right thing for you, and that they feel safe in prescribing you bridging medications, which is crucial. So there might be some things that you might want to take along to a meeting when asking about bridging medications. Firstly, if you are already self-medicating, you want to bring along information around how long you've been self-medicating for. You want to tell them the preparations of the hormones that you've been taking and the dosages, whether that has changed recently. If you've undergone any form of hormone monitoring, you might want to bring along any reports of that if you have access to them, or point out any reports that the GP themselves might have access to regarding blood monitoring. You also want to be looking at printing off potentially the guidance that we'll provide in the links below for you, just so that you can point out the sections in which it says that bridging medications are okay for GPs to do. You will also want to give them some level of reassurance that you are intending to access hormones through more official channels when, say, you've got to the end of the waiting list at your GIC, or when you have enough money to pay for private healthcare. Bridging medications have always been or are meant to be a kind of temporary measure before a more official arrangement can be made with a gender identity clinic or a private practice with your GP. So if you are asking for bridging prescriptions, usually what they'll want to see is some sort of reassurance that you intend to be referred to a gender identity clinic or a private practice, or that you're already on the waiting list. You will also be wanting to reassure them that you're committed to future monitoring. So this is really important, especially because GPs are slightly more liable in cases where bridging prescriptions are a thing. They are going to be wanting to see a commitment for you that you will go and get monitored, just to cover their backs. It's also important for your own safety too, so do make sure that you commit to doing future hormone monitoring with them. If your GP is confused about hormone monitoring, you might also want to point them to the existence of NHS endocrinologists who are specialised in this area. So it's not just GIC doctors who have a specialism in endocrinology, and it's not just the GP who'll have to interpret the results of this monitoring work. So often they might need a bit of reassurance that there are actually people in the NHS that they can go to and ask for help should they need to. So obviously, from our perspective, none of this should be necessary. No one should have to go at great lengths to reassure their doctor around issues like this, but just to be able to access basic healthcare. But that's kind of the practicalities of the situation that we're dealing with. What I'll do is pop a little letter, which is a template letter that we use when talking to GPs about bridging prescriptions, which have the kind of quotations from the relevant guidance in them, and general information about how to administer bridging prescriptions. So you can use that if you wish. If your GP is not interested in providing you with bridging prescriptions, the next step would then be to talk to your GP practice manager, who might be more willing to listen. But I guess that's all we've got time for in discussing this. But if you do need any help, or you want to ask any more questions, please don't hesitate to get in touch at info@actionfortranshealth.org.uk, and you can talk to one of our advocacy team about how to get bridging prescriptions, or any questions around monitoring or anything like that. Thank you very much, and good luck.